Well, the importance, unfortunately, is to remove the stigma that you can't talk about suicide.
No matter how difficult the conversation may be, New Jersey lawmakers are looking for new tools to prevent teen suicides. A new bill, sponsored in part by Assemblyman Benji Wimberly, looks to do just that.
The mental health aspect of this is paramount for us to address, what's the best practice and what's the best studies to prevent suicide.
If passed into law, every hospital would be required to create an annual report of the number of suicides and attempted suicides involving minors in which a drug is used. The hospitals would be required to report demographic information and what drug was used. The completed report would be sent to the New Jersey Poison Control Center of Rutgers, which would then submit a report to the governor's desk and the legislature.
Unfortunately, this has been taboo, in particularly in many minority communities. Nobody wanted to talk about, somebody trying to commit suicide or thinking about committing suicide or having those discussions.
According to the CDC, suicide is the second leading cause of death for youths ages 10 to 24.
We've seen an increase of suicides, unfortunately, that have been, completed by young folks and attempts for over the years.
Working with Assemblyman Herb Conaway on the bill, Wimberly says the data compiled from these reports would give lawmakers information they didn't have before.
This bill really is targeted towards teens, and like I said, hopefully we'll work towards the prevention, us having the knowledge of what, triggers it, what is the drug, what is the demographic that is most at risk when it comes to, suicide attempts. So all these things will definitely work in our favor as far as prevention.
The bill is set to be discussed in committee on Thursday. For Pix 11 News, I'm Jim Vassell.